Hello, and welcome to the Mimosa Matters podcast series. In this series, we will bring you interesting perspectives on the clinical, research, and technological perspectives for near-infrared spectroscopy imaging, or NIRS, and introduce you to Mimosa Diagnostics. I'm your host, Douglas Queen. Today, we are bringing you a Mimosa Matters poster chat, where you can learn from our collaborators about their important research. Thank you for tuning in and joining us on today's poster chat, where we will be hearing from Dr. Matthew Regulski. Dr. Regulski is the Medical Director of the Wound Care Institute of Ocean County in New Jersey in the United States. Welcome, Matthew.
Thank you, Doug. This is a great honor. Thank you for having me.
Let me start our conversation by asking you a few questions about your recent poster entitled Pressure Ulcer with Exposed Tendon Heals After 5 Applications of a Novel Biomimetic Matrix, a case study, such that our listeners can get some insight into your experience with NIRS imaging. Tell our listeners a brief summary of your clinical practice and experience.
I've been in practice now. This is my 22nd year here at Ocean County Foot and Ankle Surgical Associates. I'm also the director of the Wound Institute of Ocean County. Both are here in Toms River, New Jersey. So I'm predominantly doing all wound healing, diabetic limb salvage surgery, reconstructive surgery, mostly concentrating on that because that's what brings me the greatest joy.
Great, thanks. Give our listeners some background into the study featured in your recent poster at the camps and SAWC conferences.
Sure. This was a woman who was diabetic with severe rheumatoid arthritis, developed a wound right over the anterior aspect of her ankle, right with exposed tibialis anterior tendon. She had a lot of arthritis in the ankle joint and in the subtalar joint, very difficult for her to move it, but she was wearing compression socks. She didn't have the hand strength to take the compression sock off at night because she get a lot of lymphedema as well. So she wore it for 3 weeks and it rubbed right on that anterior instep, so to speak, where the leg meets into the ankle and rubbed right over the tendon and created the ulceration.
Wow. What is a biomimetic matrix and how is it used in the management of pressure injuries?
Well, this is it's a synthetic self-assembling biomimetic matrix. It's a group of specialized proteins that come in a gel, and you squirt the gel into the wound, basically. And these proteins do a lot of things. They come kind of almost in a circular fashion, so they're kind of resistant to the inflammation. They have a little bit of an antibacterial charge, but they can elaborate a tremendous amount of growth factor signaling. And also, they stimulate more of an arginine-type protein, so they're stimulating a lot of nitric oxide into the wound. Nitric oxide causes vasodilation and blood flow into the wound, but it also is a cell signaler, meaning that it draws multiple cell types into the wounds, fibroblasts, keratinocytes, endothelial cells. So it was really fascinating stuff to be using because of those capabilities just in a gel. It was fascinating.
Great, thank you. And what was the outcome of your case study featured in the poster?
Well, the outcome was that we healed the wound, which was incredible because I couldn't use a total contact cast to immobilize and take the pressure off the tendon because you don't want the tendon moving and sliding. So, as I discussed with the family, because she was very feeble and she was 86 years old, I believe, with rheumatoid, on prednisone, and multiple biologics, vascular disease issues, neuropathy, difficulty walking, we were able to fix that and heal that wound. But we did a lot of good things with my prepare to repair mantra that you're familiar with, that I published on good things that you have to do each and every time you see a wound patient. And I think we prepared that wound bed really well, and with all the nutrition aspects, the blood flow issues, all of that. And then once we started with the matrix, it took off like gangbusters, and we saw a tremendous amount of healing. So it was a wonderful outcome.
Great. And how did NIRS imaging help with this study?
Well, we were able to give me real-time assessment of what was going on, not only in the wound bed, also in the peri-wound tissue. And when we did that, we could see that she had really low oxygen in the wound bed, but also around it. It was low, around 50 to 60. So we were able then to send her over to our vascular people so they could take a look at it as well. But she was really calcified all the way down. She didn't have any focal lesions. She had a tremendous amount of calcification. She was like a lead pipe all the way down. And she had decent inflow up in the groin and up into the thigh. So they didn't think that it was still there wasn't an emergent position by them. She didn't have rest pain, but she had a lot of calcification. But with the NIRS, we were able to see real time, looking at that blood flow and assessing her oxygen saturation and her temperature. There wasn't an acute infection going on, which NIRS can actually show you if you have an acute infection, because it almost gets white hot in that peri-wound tissue. So her blood flow, as I explained to them, it was decent. It wasn't terrible, but it wasn't great. And we were able to see that with NIRS at that time and be able to make that assessment and then move into more advanced therapies once we prepared the tissue to repair itself. And she had a great outcome despite all these comorbidities, despite medications that she was on that impede her wound healing, despite being a diabetic and her A1C was close to 9. But we were able to improve nutrition. We got rid of the edema because she had a lot of lymphedema in the leg. Because when you can remove the edema, you increase more oxygen, because as the leg swells, pulls the arterioles farther apart in the skin, making it a greater distance. Oxygen has to go to diffuse into the wound. And through that compression, we were able to show an increase in oxygenation with NIRS. Real-time assessment that I could make clinical decisions in a snap and bring this lady into healing.
Great, thanks. And what would be the one key message that your fellow clinicians should take from reading this poster?
Well, I think that they should, first of all, follow the prepare to repair mantra that I've developed. 15 things you do each and every time you see the wound patient. We can't look at the hole in the patient. We need to look at the whole patient. Multiple things conspire to create the wound, and multiple things have to conspire to heal the wound. But with NIRS, I was able to have real-time assessment of what was going on within the wound bed and be able to move my patient over to vascular specialists for evaluation, because we could see that the oxygen was so-so. But at the same time, by reducing all of that nasty edema, getting rid of the biofilm, improving her nutrition, with NIRS, we had real-time assessment of improvement of oxygen into the wound, getting rid of biofilm, mitigating the inflammation by adding collagen and an absorptive bandage to pull the inflammatory exudate, but also some mild compression for her, because she was really a 3 to 4 plus pitting edema, inverted champagne bottle appearance to her leg. And we could actually see that now we were progressing, because we could see an increase in oxygen within the wound, but also in the peri-wound tissue. So it gives you that confidence to know what to do, how to do it, and when to do it.
Great. Thank you, Matthew.
Mm-hmm.
Thank you for giving our listeners an in-depth insight into NIRS imaging, Mimosa Pro, and its utility in clinical practice. Well, that's our poster chat for today. We hope you gained some new perspectives on NIRS imaging and its utility in wound management. Be sure to visit Mimosa Diagnostics at www.mimosadiagnostics.com and check out our Mimosa Learning Plus section for a copy of the poster and the video podcast. Also visit our social media channels. Add your comments and learnings. We want to hear from you.